Hello, everyone, and hopefully you are all staying home, staying safe, and everybody is healthy, all your family and all your loved one. Welcome to another coffee break with DVTA. My name is Eliane. I am the president of Delaware Valley Translators Association. I am today going to have my coffee with Claudia Angelica Reyes-Hull, the manager of ChristianaCare's Language Services. Hi, Claudia, how are you?
I'm good. Thank you for having me, Eliane.
It's so nice having you. Claudia, I am going to just start with a little bit of logistics about DVTA and what we are having, and then we're going to start the interview and start our talk. First, I would like to thank you all the board of directors of DVTA. I will start with Eliane Sfeir, the vice president and my partner in crime. We work all the time together and she's always helping me preparing all the events, all the interviews, and all what we are going to be doing now for the summit. I would like to thank Jacqueline Kershaw. Jackie is the director of the membership and she's always answering your phone calls and answering your emails regarding the membership. Petra Reichert is our treasurer. She's always putting us in good shape so we can offer you more free stuff. And Charlotte Storer is our secretary, and she's the one who's taking notes and she's the one who reminds us of anything that we forget. Rita Whale is the editor, so all the newsletters, all the emails that you see in your inbox, that you're getting in your inbox, Rita Whale is making sure that our English is correct. And Young Mei Lee is taking care of all the newsletter, all the free webinars, all the stuff that she feels that she needs to share with our DVTA members, and she's the one taking care of the newsletter. She's our writer. Magdalise Rura, she's taking off social media and she will be putting this video online and all on all the website and platforms, and she's also taking care of our website. And Natalia Petrova, she's our marketing committee chair and she's helping us having better and better marketing outreach. Thank you for our board of directors. They are working really very hard, even now that we moved the summit. And as you know, the summit has been canceled. And however, we are going to be having online presentation. And our first presentation is going to be for our translators so that they feel they are not at all excluded, even though their work is still at home, but we know that they've been affected. And Yot Zeche is going to be giving the talk about translation technology and the future of the translation profession. Thank you so much. Claudia, thank you so much for being patient and letting me give them just a news brief about what's happening with the DVTA. Thank you so much for giving us your time. Thank you so much. I know you're very, very busy. You're now working from home, but you also still interpret, even though you are still the manager, you're still interpreting because you like the interpretation profession. Before we start talking about COVID-19, can you talk a little bit? Tell us, how did you start the language services at ChristianaCare? I know that you worked with Jackie Ortiz, the Director of Health Equity and Cultural Competence. Mm-hmm. So tell us more about your adventure. Full disclosure, I work with ChristianaCare as a contractor and I love being there. It's my, I feel it's like a Disneyland for interpreters where they have all their rights and everybody knows the purple interpreters are there. So they know how to work with them.
And Eliane has her purple eggplant wardrobe when she goes interprets
yes.
Christiana, definitely. So my journey at ChristianaCare started about 8 years ago. When Jackie Ortiz took a chance and hired me as an interpreter for the evening for the emergency room. I had just moved to the Philadelphia area and I didn't even know where Delaware was, so because ChristianaCare is in Delaware. And I started there as the evening interpreter, doing all interpreting for Spanish, trauma, CD, emergencies, birth. I think the first day that I was there, I had a C-section and a trauma all like
Oh,
not together, like
yeah.
separately, but at that same day. And Jackie was also new in her position in Christiana
Mm-hmm.
Care. And as we started working together, the language services started growing from 3 interpreters to 10 interpreters. And there was a lot more information coming through. 1557 started sounding more like important,
Yeah.
how those
Uh-huh.
things are. And Jackie started growing in her position from, she was a manager, she became a director, and she again took a risk on me, and she made me manager of language services. That's about 5 years ago. Since then, we've grown to 17 interpreters for staff interpreters, and we work with our partner agencies and our partner contractors to give the service to all the population that needs it in Christiana Care. What has been amazing on
Mm-hmm.
this journey has been, first of all, there's been a lot of changes, and we're not even talking about the changes right now. But
Yes.
there's been a lot of changes in what language services and health equity,
Uh-huh.
the importance in healthcare, and we've changed presidents in the hospital.
Mm-hmm.
One time, we have now our president is a female physician, Dr.
Yes.
Janice Nevin,
Uh-huh.
and she became very much of a supporter on what it is language services and cultural competence. And from leadership, to every single layer of leadership has been supporting our efforts to give language access to our community, which has been incredible. We
That was my
again.
next question, Claudia, is
Mhm.
that how were you able, language services offices in every hospital is not an income generating office. We don't generate income. If anything, we take. How were you, how you have so much support? Your community, the whole culture in the hospital is supporting the the patient who doesn't speak English very well,
I
and
think it
supporting the equality of information for that person, for that
Yes, and
patient.
I think it's not just because yes, we're not an income generator. We are an expense, and whenever it comes to budget times, we know that. Uh, but it is kind of the business of the cost of doing business every day in healthcare. But I think, and speaking about Christiana Care, we are, and I say we because I really feel proud of being part of it. We really believe that we are part of a community, and we take
Mhm.
care of the whole community. Christiana Care is a nonprofit healthcare system, and
You hold on to nonprofit.
we are nonprofit, and we take care of everybody as part of that community.
Mhm.
And it's not just the Delaware community, because we have locations in Delaware, New Jersey, Maryland, and Pennsylvania.
Mhm.
And I think it's always been the Christiana Care way that we really care for our community in a very respectful way, and making sure that we give the best service to everyone, regardless of the
Yeah.
difference.
And you said the Christiana Care way. I think I've one of the webinars that I've assisted to and listened to is that as long as you hold on to the mission statement, as long as you hold on to the way, you will keep on going towards the peak. You will keep on going up in the success steps and ladder. And I think I see this personally in Christiana. I see it that the mission statement is still on everybody's shoulder. It's like it's not back in their mind. It is on the shoulders all the time. And that's what I love about Christiana Care. And I love about all what you're doing, not only for for non-English speakers or the limited English patient, but also for cultural awareness, for all what has to do with really the health of the patient, not only physically, but also helping him to get into the health that he needs.
Yes, and it's our philosophy changed a little bit ago because we changed branding and everything, but our philosophy changed from yes, being respectful neighbors to what it is now, for the love of health. We are not a hospital. We are healthcare. And the love of what we do towards bringing all our community to optimal health. I think most of the people that go into healthcare do it because they care.
Yes.
And they really want to care for other people. So having that as our philosophy for the love of health is very important, and we do live it in Christiana Care. I have to say, and I think you've visited, you've worked with us for over 2 years
from
now.
Doctors to nurses to interpreters to even the atmosphere, the whole environment, the smiles on everybody's face all the time. I think that's the love of health. So I don't know, how is COVID-19 loving us with this? So how is COVID-19 affecting your work? What happened to the office? Give us as much information for us medical interpreters. What's going to happen to us?
Well, like everybody else, that it just turned everything upside down. And we at Christiana Care have been in language services. We've always been very adventurous in many ways. I'll self-proclaim myself as an early adopter. So all this technology and everything that comes around, I have to try it, check if it works for us, and I start putting technology at the reach of interpreters' hands, caregivers' hands. We call our physicians and our nurses and all the people that work in Christiana, we call them caregivers. So I will be using caregivers a lot.
Nice.
So we in language services adopted technology a long time ago. You have worked with our technology.
Oh, yes, very progressive.
and we've always been pushing technology, even for our interpreters. We believe that the best kind of interpreting is in person. There is something about that in-person interpreter that's going to make that encounter so much better. Our caregivers, our physicians, nurses believe in that too, because they've worked with us as part of their team for a long time. So when this COVID-19 pandemic started, when it started sounding, before it was a pandemic, we knew that we were going to have to do the switch from in-person to virtual. And this is because we know the importance of wearing PPE, personal protective equipment, when we're giving a service in healthcare. So we started planning, and we started making sure that everybody was set up at home to do video interpreting. And we already had a good army of iPads everywhere in the system. In the health system that we were going to be doing interpreting through. That really affected some areas more than others, because it's not the same thing interpret for a birth through a video unit that interpret for a medical clinical appointment. So it affected our caregivers a lot. They did feel like, wait, where's my interpreter? I need my interpreter here. It affected our patients too, But because I think there's a little bit of, first of all, they knew all the team as part of the team. They knew the eggplant scrubs
Uniform,
that
yes.
we were, uniform. So the fact that they started seeing that purple uniform, the eggplant uniform, pop up when they pressed the button in the video interpreter unit,
Yes.
that made people feel like, oh, they're still here. The interpreters
Yes,
are
that's such
still
a beautiful
here.
feeling. Yeah.
So, and part recognition, in part, yes, there was no hiccup there because they still had the video interpreter. They will the caregiver is still receiving, even right now, the services of the team that they have received services from even before. So it was hard in the sense that we had to become really good in all the technology as interpreters really fast.
Yes.
And we had to transfer a team of 17 interpreters from office and hospital to home in 2 weeks.
And you did it. Wow.
And we did it. And yeah, we're in week 11 now. This is week 11.
Yeah, I stopped counting because I don't know what day we are, what month we are. It's like, yeah. Wow, week 11, and you were able to move all your team, 17 interpreters, from on the floor to at home.
Yes, and one scheduler.
Congratulations.
And one scheduler.
And yes, and one scheduler. Yes. How is she doing? We miss her.
We all miss everybody.
She's also working from home?
She's also working from home, and let's say that we became really good partners with IT.
Okay. We love IT.
But the great thing is that with all this new technology, all this conferencing apps, Zoom, Teams, we were able to keep that interaction live, not just interpreting over video, but also having team meetings, huddles, in a way that we all kept connected. Because let's be frank, we need the connection.
Yes.
As human beings, we need the connection, but as interpreters, we almost need it more. We, like at ChristianaCare, we are a family. We all work very closely. We see each other every day, pretty much, or very often.
And you kept this via all the platforms, and you stayed connected.
We stay connected. We have a huddle every day. So everybody is free to join, get all the news that are going on in the system, but also just chat and check on each other, make sure that everybody's doing okay.
Like a chat over the water fountain, yes?
Exactly.
That is so
over
beautiful.
Coffee.
Over coffee. Day over coffee.
Over coffee.
So my question for you, I'm thinking as a medical interpreter myself, and now that I've changed to remote interpreting and I am joining, I'm riding the wave instead of fighting it. What do you think of face-to-face? Do you think we're gonna stay in remote interpreting? I know that telehealth is like my doctor, I call him, and it is telehealth. Do you think telehealth is gonna stay? Do you think remote interpreting is gonna stay? Do you think we're gonna do more of this virtual life is going to be our new normal?
So our new normal, who knows? But I can tell you that telehealth is here to stay. How much? I don't know. Nobody really knows. There's still going to be a lot of virtual because there is a lot of benefits to being a virtual interpreter. There's also downsides to it. You and I have been on the floors. We've interpreted in person for how many years now?
Yeah.
And we know that there is Let's not talk about that one.
Forget about it.
But you know that there is that connection
Mm-hmm.
that you have when you're in person. You know that there's that traveling around, moving in the room to be in the best position to be able to give that interpretation. And that sense of warmth of making sure that everything is going to be okay because the interpreter's there, that you can't really have virtually, or it's
Yeah.
harder to have virtually. So in person is always going to be great. But why I'm saying this is that we have been in person, but we can now um, match our virtual self to that in-person way of doing things. I think, like I always, when I train now my interpreters in new processes and everything, I tell them, just think when you were in person in that C-section. Where
Okay.
did you sit? Where were you sitting? And what was the preferred way to interpret? So you can guide your provider and say, hey, you know what? Can you place the video unit this way or that way so I can see the patient's face, so I can really hear everything? Now that we're working with providers and patients that are wearing
Mm-hmm.
face masks, it's
Yeah, how
fabulous.
is that?
We don't have to work and wear the face mask. So on video, we don't have to wear the face mask. The patient
You're
can see
right. That would be
everything.
very hard to interpret and to listen to you for the patient. Already he's having trouble understanding English, having trouble listening to his own language. That would be very hard.
It is. It is really hard when you're interpreting through a mask. When
Yes.
you're interpreting on a video, you don't have that barrier.
Okay.
You do have to guide the patient and the provider to say, hey, can you push it closer? Can you speak louder to the speaker, to the microphone? It's funny because in person we always tell the provider, speak directly to the patient, don't speak to me. In
Yes.
this case, in video, you kind of want them to speak to you so that you can hear them really well. Like
Okay.
not to you, but towards
Yes,
you.
towards you, at least so you can hear them through the
Yeah.
mask. Yes.
So yeah, I think we're all gonna have to get better at video because video is still gonna be, and phone, it's still gonna be a preferred mode of interpreting for a long time.
Yeah.
But I think that in-person
Mhm.
interpreting is gonna come back. It's gonna come back gradually. I
Are
know
you
that
planning to come back to in person?
we are.
Oh,
When
that's nice news. So you are.
we are, I don't know when exactly. There's no
Okay.
timeline for that.
Mm-hmm.
But I know that there's some systems, some healthcare systems, hospitals in the area that are still doing in-person interpreting.
Okay. Okay.
So I think it's a preference of the caregivers, it's a preference of the hospital, and it's
Mhm.
also an evaluation on how much cross-contamination or how much PPE is going to be involved in the interpreting.
Yes. Yeah, definitely. And how much the cross contamination is going to affect, because interpreters, we go from one clinic to another, and yes, that's a lot. You're right. Wow, Claudia, I can spend so much time with you talking about all this. We still did not talk about so many things that I wanted to ask you, but I know that you are very busy. And I thank you very, very much for giving us your time and for talking to us. And hopefully we will be seeing you very soon in person when all this goes away and we are safe to hug each other and kiss each other. Thank you so much and have
Sure.
a nice day.
You too. Ooh, take care.
Something fell. Okay.